Welcome, welcome. So this is another one of our famous workshops, if you will. This one's obviously on heart health. It's this topic is very, very near and dear to my heart. It is, especially my father, probably since the mid-90s, he's got cardiovascular disease. He's almost died a number of times from this, so it's a topic that really sticks to me. It really hits home to me, so I do a lot of research on it, stay on the times with this, and working on improving his life as much as possible. But these steps, what you're going to hear some things you haven't heard before on heart disease tonight. You're going to hear some truths and some lies that are out there. And then we're going to talk about just take away things that you can do. We're going to go over seven steps you can start tomorrow, even when you get home, and how you can pretty much become a heart disease fighter. And pretty much the only way to cure heart disease right now is not to get it in the first place. So that being said, we're going to go through this. If you have questions, just let me know. There we go. So we start with statistics. So if you look at statistics, is that glaring on anyone? You guys good? You don't see it? So it's 1 out of 2. So if you look, there's 1 out of 2 people die of heart disease. Wow. And we look at even farther, 25% of kids, 5 and older, they already have plaque forming on their arteries. 25%. It's an astonishing number. Look at the total number of deaths. So number one cause of death in the U.S. So 871,000 deaths per year from heart disease. It's a ton of deaths. If we look at the myths and truths and what we think about, so we think that what heart disease is normal, heart disease is common because everybody has it. It's not. There's a ton of countries where it's just not an issue. There's a lot of cultures where heart disease is just not an issue. But in this culture, it's very, very common in North America, Canada, U.S. Part of the reason being, guess what? It's lifestyle. It's what we're doing to ourselves. We're doing it to ourselves. It's our standard American diet that we eat, the high refined carbs, high saturated fats, the lack of exercise, stressing ourselves out in the workplace, taking a lot of pharmacology, a lot of pharmaceuticals day in and day out. That all leads into toxicity, which in turn can cause you to become, unfortunately, have heart disease. Now, if we look into it, what I touched on earlier, so what causes heart disease? The only way, same thing with cancer. There's no cold-cut cure for cancer. The only way that it is prevention. So let's work on prevention. Let's really focus on prevention, on how we can avoid getting it. I was like, that's why I put it on there. You've got a rare condition called good health. Not many of us, we know the doctor, you see that too often, especially then. If you can picture your heart, so it's a muscle. So this is 1 liter. This is 1 liter. This is how awesome our body is. 7,200 liters per day of blood. 7,200 liters a day of that. Just fill this up with blood, and that's what's going through your body. It's enough to fill up your car 180 times. That's just what your body is doing. So what happens over time? Your body can form plaque around the arteries, and it can come from various things. First thing we're going to touch on is cholesterol. So is cholesterol good or bad?
Both.
There's good and bad cholesterol, right? So we've heard of the HDL cholesterol. We've heard of that good and bad cholesterol. So the good cholesterol is called HDL. That stands for high density lipoprotein. That's what the name means, anything. But your HDL cholesterol, the higher you can get this number, the better you're going to be. So you get this number higher from not having an acidic diet, not becoming a couch potato, stressing through everything what we just touched on. When you get that number higher, it can bring that LDL ratio down. And the LDL number, what that is, that's your bad cholesterol. And you see the differences between the two. It forms plaque, so it can form a thick hard deposit as well. Without cholesterol, you cannot make major hormones. You cannot make testosterone, you cannot make estrogen, and a host of other vital hormones. Without cholesterol, it is a necessary part of function. So without a doubt, it's a high cholesterol myth that's what we're dying from heart disease, is from high cholesterol. It's not. That's from inflammation. I'm going to really hammer home on inflammation. You're going to be able to understand that here in a couple slides. So here's some other truths. So does cholesterol cause heart disease? There's some statistics that I was looking into earlier. So it's the oxidation of cholesterol that causes heart disease. So what that means, when cholesterol oxidizes, it can form something called atherosclerosis. That's when plaque will form around your arteries. Specifically, there you have two major arteries in your neck called your coronary arteries. That pretty much gives you your blood flow to your brain. When that gets constricted, if you've ever seen MMA fighters, when they're putting them in a chokehold, what they're doing is they're choking off that carotid artery. That's what's allowing them, and then the blood supply shuts down and then they pass out. So similarly with oxidation of cholesterol, what's happening with there is it's not so much the cholesterol itself, it's from the plaque and the atherosclerosis that's forming from the damage that's taking place. Now if we look at this as well, more people have heart attacks with normal cholesterol than elevated. So that's a truth. What they have found is that about 75% of heart attacks, what they're finding is that the cholesterol levels when they're testing them, they're normal cholesterol levels when they're having the heart attack. 75%, so 3 out of 4 is from they're having normal cholesterol. So it's been a guide that cardiologists are focusing on, but they're looking at the wrong numbers. So what they're doing now, it's called disease monitoring. So back in the day, high cholesterol used to be 300. It's now, anyone know what high cholesterol is now? It's down to 200. Now they call it 200. So what did they in turn do by changing those numbers? Think about it now. Unfortunately, what's it all about?
Selling drugs.
Selling drugs. Money, money, money. It's the root of all evil. It's what, unfortunately, it's what, especially here in the United States. Remember, we make up 5% of the world's population. We take anywhere between 70 to 75% of the world's drugs. So if that culture was working, we'd be in better off shape. So I think 5% means 95% of the rest of the world is taking the other 20 to 30% of the world's drugs. Something wrong with that. Now, the cholesterol, so when we talk about the body's repair substance, whenever inflammation occurs in the body, the liver has to produce more cholesterol. So inflammation equals more cholesterol. So the overall goal here is how can we focus on not getting inflamed? What can we do? Now, when we go and our cholesterol is high, the doc puts us on what's called a statin. That's the primary drug they're going to put you in. It's going to be a statin drug. There's tons of them out there in the market. There is an article which I have for all of you. It's a long one, so it's going to take some time to read on your own time. You are welcome. Now, what it goes, so this was an article by, his name is Dr. Mercola. He's a medical doctor that I follow, and I do a lot of reading on him. I love his stuff. But he goes into just really hammer on how much of a scam these statins are becoming, from how much money is being made just from lowering the numbers, but as well as the effects. What they're finding is that just from putting, the data is not there to support all these people being put on these statin drugs. Because the side effects alone from here, it causes liver damage, it causes neuropathy, which is numbness, tingling in the legs and in the extremities, joint pain, muscle wasting and atrophy, that's when your muscles will wear away on you, heart failure, I kind of thought that's what we were taking the cholesterol medication for. Limits protection from cholesterol against cancer, depression, and it stops coenzyme Q10 production. How many of you heard of coenzyme Q10? A couple of you. So it's a very, very important, we're going to talk about coenzyme here in a second, on how important it is. There we go. So if you look at the dangers of these statin drugs, what happens? So your brain tissue is made up of 60% cholesterol, but what we do, so if you lower the cholesterol drugs, what it's doing is it's blocking your serotonin levels in your brain. Now serotonin, that's pretty much your happy hormone. So when your serotonin levels are blocked, that leads us into depression mode, anxiety mode, and that's what the statin drugs are known for doing. So what they'll do is they'll put you on a statin drug, but what do you think they're going to also put you on? Put you on so they're going to put you on depression med, because they know the serotonin levels are going to tank. You're going to be calling them in 2 months saying, "Doc, I feel terrible. I don't want to get out of the house." So that's where the ball begins. And then you look at the side effects we're just touching on. There's a side effect for heart failure, and it's what you're trying to treat. Coenzyme Q10. Now, if you've had heart disease in the past, or if you currently are suffering from heart disease, you have to get on coenzyme Q10. If If you're currently on a stat, you have to be on coenzyme Q10 yesterday, and is that mandatory to get on it because what it's blocking it. What that does is it reduces inflammation from cancer and aging. So picture coenzyme Q10 is a trolley. It's the T you need to pick up in Bethel Park to get downtown. It's your transportation system from the blocks for cells. It's transporting it from your brain, from the cells to your brain and nervous system. So picture you getting on that T to go downtown into the city, because that's the only way you can get there. Now that T goes away. You cannot get on the trolley anymore. That's what taking the statin drugs is doing. It's taking away the communication level. It's taking away your transportation, if you will. You have no way. It has no way to get there. So that, and then it stops getting produced. And when it starts getting produced, and now we're going to have a whole other ton of issues, if you will, from the serotonin all on up.
Wouldn't it be better to just stop taking the statin rather than taking the statin and then adding another supplement to it?
Right. That's what they. You have to understand. That's what they are educated. They're based off of numbers. So if they reach you a certain number, their algorithm says, Fred, your cholesterol is at 260. My book here says I'm supposed to put you on X, Y, and Z medication. So that's what they follow. So you fit the mold.
Right.
That's what they know. So that's what they're training. So if we can prevent it by changing our lifestyle, because it's not genetics. It's about 5% genetics. It's not a genetic predisposition. It's from our lifestyle. It's from years and years of damage and decay we've done to ourselves. Here's the primary takeaway. It's inflammation. This is the primary cause of heart disease. It's not because we don't have enough cholesterol medication in our body. It's not why we're getting heart disease. So if you look at a normal artery, and this is a cross-section of an artery, picture this as like a garden hose. And what the garden hose is doing is it has that, this is blood traveling all through there. And that cross-section, that blood's able to flow as it should. Now what causes inflammation? From what we were touching on earlier, from salt in your diet, from the exercise, from an acidic diet. It's not just diet alone, from smoking, drinking, all these risk factors. Now over time what happens? Now you look at number B, that cross-section, now you have a little bit of inflammation taking place. So the inflammation now, the cross-section, now the blood only has that little space to go through. We take it to the next step, now it's totally occluded, now there's no blood pretty much able to go through. And then the last one here, so that's the 911, they call that the widowmaker, that's an aneurysm. No signs or symptoms of it. I'll take it aside you on a patient's lower back, and you have an abdominal aorta, which is your primary blood flow into your legs. And when that calcifies, you can really start to see this thing on x-ray. But what happens is all that plaque will build up, and then you start to see it on an x-ray of the aorta and all. But what it will do, the aneurysm now, you look at the cross-section here, so some of the blood's traveling through, but here it has complete blockage and it reverts back into the blood. It's going the opposite way in the artery. So what that's going to do, the aneurysm, unfortunately, that can cause earlier immediate death. So that's from inflammation. The warning sign, the primary warning sign we have to be cognizant of is you have to be aware of your blood pressure. You have to know where your blood pressure is at on any given day. High blood pressure is the #1 warning sign. It's starting to slowly elevate. That's your body telling you that something's going on. Now, pharmaceutically, they're going to give you a blood pressure med to lower it the unorthodox way, the non-natural way. So now we've gone from just having a condition of heart disease. Now what are we on? We're on cholesterol meds, antidepressant meds, and blood pressure meds. We're on 3 meds before we got out the front door. That's just for one condition. Let's say you have a chronic lower back issue for pain meds and anti-inflammatories. Let's say you have something else going on, where you have a history where you have metabolic syndrome, you're diabetic. So you can kind of see how this windfall is just a toxic mess. Now, the warning signs here, what the high blood pressure will do. So stage 1 hypertension is right around 130/90. It used to not be that high. So once again, what they do, it used to be about 140/90, but they lowered the number. So what they do by lowering the number, same thing. They open up to all these new patients. Their sales list just got a lot bigger, just by dropping those numbers down. And type 2 diabetes, same thing. Sugar-wise, it used to not be 126 is where the sugar is at now. It used to not be that. It used to be higher than that, but they lowered the number for type 2 diabetes. Now, you're diabetic now at 126 when your blood sugar is over that level. That puts you on glucose, insulin, metformin, etc. So the meat and potatoes of this are coming right here. Those of you who use the internet, I highly challenge you to Google this Time Magazine article. It is fantastic. It's on the secret killer on heart disease, cancer, and Alzheimer's disease. It goes over inflammation. So inflammation, so the 4 primary components we're going to touch on. First one, sugar. Second one's improper ratio of fatty acids. Number 3 is becoming acidic. And number 4 is free radicals. And I'll break these down into becoming a more common knowledge for you on what they are. So number 1, we'll